My name's Natalia and I'm an occupational therapy student, and for the past 3 months I've been doing my clinical rotation or my second level 2 field work at the lymphedema clinic. So I've been working with a lymphedema occupational therapist, and I have noticed the need for some at-home help and instruction for people to follow along with at home to make it easier for them to manage their condition. So basically, I am not an expert. I am not certified in lymphedema therapy. However, I do feel like I've learned a lot over the past 3 months and that I could share some of this knowledge with you at home. So the topic of today's video is going to be a follow-along step-by-step instruction of self-manual lymphatic drainage massage of the right upper extremity and right upper quadrant. So we can get started with the massage. I'll give you some tips beforehand. So the first tip that I would like to talk about is I'm in a seated position for the purposes of the video and instructing. However, at home, it's really best if you're laying down or in a recliner chair or in your bed, so that you are at a more comfortable position and so that all of your lymph nodes are open and nothing's cut off, and that your lymphatic flow can be easily moved throughout your body. So that's the first tip. The second tip is that while you're doing the massage, one of the most important things is that you want skin-to-skin contact, and you want to use your entire hand. You do not just want to use your fingertips. You don't want to have your fingertips spread. You want your hand like this, and you want skin-to-skin contact. Another important tip is when you're doing circular motions, you are moving the tissue of your skin with your hand. You are not sliding over your skin. So your lymph vessels and system live right underneath your skin. They're very on the surface level of your skin. So we really want to move that tissue to get the fluid to move along where we want it to go. So with that being said, we don't want you to be using lotions or oils while you're doing this massage, because that'll just create the gliding effect, and we don't really want that. We want the skin to be moving along with our hand. So with that being said, we can start the massage. The first part is to do circles at the neck, and this is around your collarbone area, kind of this upper chest area. So I'm using my right hand to go to my left side, and my circles are going inwards towards my heart. It's really important that you have the right directionality with your movements, and it's less important about the amount of repetitions. So if you do 5 to 10 circles, that's okay if you lose count or something, but it's really important that you're going the right direction. We don't want you going outwards towards your affected extremity, because we don't want the fluid to build up in those areas. So I'm always going inwards towards the heart with these, and I'm doing about 5 to 10 of them. You can follow along. After the neck, we're gonna do our deep abdominal breathing. So we have hot spots of lymph nodes in our body. We have them in our head and neck, our armpits, our hips, and our abdomen. So these deep abdominal breaths are gonna stimulate this. And basically the way that we do these is to breathe in through your nose like you're breathing in the smell of roses. You're letting your belly expand, and then out through your mouth like you're blowing out birthday candles and letting your belly collapse. So you're gonna do that about 10 times. Five more. Good. So after we do our deep belly breathing, our next important thing to note is that with this massage, we're really trying to move the lymph fluid from the affected extremity, so in this case, our right affected extremity and lymph nodes, over to the next closest, healthiest lymph nodes. So our main pathways that we're going to be pushing fluid is over to these left lymph nodes and down to these right hip lymph nodes. So this next part is going to be us waking up these left armpit lymph nodes. So I'll take this off so we can see better. We have our arm raised here, and I'm just going to do circles inwards, and I'm just going to be stimulating my armpit lymph nodes here. And I can do about 10 of these. Okay, so after we stimulate these, we're going to be moving the fluid over from here to here. We're going to be doing our circles over towards this side. If you have trouble doing circles, you can push and lift like this. You can also just do your circles, and then if it gets difficult, you can use your other hand to kind of help along. You can use this hand. It doesn't matter. It's just whatever is most comfortable for you to move along to this side. Again, you're doing skin to skin contact. My whole fingers and palm are in contact with my skin the whole time, and I am going in this direction. We're going to do about 5 of those. So I think we'll do one more just for good measure. So after we do across the chest, we're going to open up our right hip lymph nodes, and this is right where you think that your underwear line would be if you're a woman, or it's where when you sit, it's where the crease is in between your thigh and your hip abdomen area. So I'm going to be going in upward motions like so to stimulate these lymph nodes on the right side. And this is just opening these up, and I'm going in upward motions, and I can do about 10 of them. After we open these up, just like we opened this up and then we went across, we're going to open this up and then go down. So the best way to do this is just whatever is most comfortable, but you definitely want to be doing these downward circles all the way down to your hip. So if this works for you, or if you need to do it with this hand, you can do this. Again, I'm lifting in between each movement, and I'm keeping full contact of my hand. And we're gonna go down about 5 times. I think that was like 4, so we can do 5. Okay, so this is the next step. If you have a partner, this is where you'd use your partner. You'd lie on your left side and you'd have them go down towards your hip and down and back across the back and down. But in those half circles type of deal. If you do not have a partner, that's totally fine. We can skip this step and it's no big deal. So if we have to skip this step, we're just going to keep going down another 5 times. So you can do that a total of 10 times if you end up skipping that step every time. And you're just going down towards the hip again. So now, after we've done that again 5 times, we're going to use our hands to massage any edema in the breast area. If your breast is your trouble area, you want to spend more time on this. So whatever you feel like is your trouble area, you can always spend more time. This is just basic massage follow through. You can pause the video at the spot that you feel like you need to do more at, or you can replay this part, whatever is best for you. But basically, I'm using my hand to push on the top and the bottom of this breast, and I'm pushing the fluid outwards. I want to push it outwards towards the lateral side of our breast, and then we're going to push it down after we do that. So we're gonna go down 5 more times. We're really clearing out all of this here before we get to our upper extremity. So that's about 3, here's 4, and you can always do this again, whatever feels easiest for you. And we'll just do 1 more. And that's 5. So basically after we do that and we move back down from the breast, we're going to be starting the arm at this point. We're going to do our shoulder massage. We're going to start at the shoulder. So we're using our hand to do these circles inwards towards the heart. And I'm going to do about 10 of them. 5 to 10 is good. Okay, now we get to start on the arm. So starting with the upper arm, we can think about our arm in strips. So this is 1 and this is 2. If you have a smaller hand, you have a bigger arm, you're having a hard time getting enough coverage, you can do 3. So you can do 1, 2, 3. Just depends on whatever's most effective for you. So we're gonna start here from the inside, and I'm going up. I'm doing the circles up here, and I'm starting at the elbow and going up to the shoulder. And you're gonna do 5 times on each part of your arm. So this is 3, and then 4. Again, I'm lifting my hand in between each. I'm not sliding. I'm keeping full contact with each circle. My fingers are going around. I'm getting lots of coverage this way. And that's 5, I think. Now I'm gonna flip my arm and I'm gonna do the back side. So that's 1, 2, 3, and 4, and 5. So after we do that, we're gonna go down to our forearm. Our forearm is also gonna be in strips. We're gonna do the front, then we're gonna do the back. We're gonna go from the wrist to the elbow. So I'm doing my upward circles, and I'm going up from the wrist all the way to the elbow. And I'm gonna do these 5 times on each side. So that's 3, 4, and 5. Gonna do the other side now. 1, 2, 3, 4, and 5. So after I do that, I've gone up both sides. I'm gonna go back up on this upper arm because we just pushed the fluid to our elbow and now we gotta keep going up. So we're gonna start on the front just like we did before, and we're gonna do 5. This is 3, 4, and 5. And then we're gonna do the back side. 1, 2, 3, 4, and 5. Okay, we can do our shoulder circles again towards the heart or inwards, whichever way makes most sense to you. Okay, about 10 of those. And now we're gonna move back across the chest and back down the side. So we'll start at the chest. So we'll go across, and we can switch hands to make it easier on us. 1. This is the second one. This is 3. 4. 5. And you can always do one more if you feel like you didn't count right. Okay. So now I'm going to go back down my side 5 times. 1, 2, 3, 4, 5. Okay, so after we've done this and this again, we're going to do our deep breathing, and then that's our final step. So we'll do our deep breathing, placing both hands on our abdomen, breathing in, letting our belly expand, and breathing out, letting our belly fall. Three more. Okay, so thank you so much for watching this video and following along. I hope you feel refreshed and ready to do whatever you need to do next. Hope you have a great rest of your day.